Today we'll talk about the advantages of the suture technique. However, to discuss the advantages of suture technique, we need to understand the mechanics of suture technique and what it really is and what it really does. First of all, the advantage of suture technique is that there's an even distribution of the tension that is placed to create the fold. Whereas an open technique relies on individual suturing, a suture technique relies on one suture where the tension is evenly distributed. And this is for modern suture techniques that is applied where only one suture is used to evenly distribute tension. So there's a nice even crease that is formed. Second of all, a fold in double eyelid surgery, in order to understand that, we need to look at what a natural fold is. A person with a natural fold is a crease. It really is a fold in that it is a concavity, in that there is a depression. Whereas a open technique relies on scar formation, so there is a convexity. So you're creating a mass versus creating almost an empty space where a skin can invaginate in. The advantage of suture technique is that it mimics that mechanism in that it creates a fold. So there's a complete opposite effect versus an open technique versus a suture technique. An open technique, we have to create scar because the mechanism is relying on scar with suturing by making an incision. And whenever you make an incision, there's a scar formation. Whereas a suture technique does not have a scar, and there is a concavity where it goes in. So it really mimics a natural fold. Third is that the suture technique is dynamic. What do I mean by dynamic? Dynamic, there's a degree of how dynamic a fold is. When comparing suture technique versus an open technique, suture technique, it open when the eye opens and closes, the suture goes in and out. So it really functions like a natural fold. And we'll go further into the dynamics of suture techniques and the degree of dynamics of suture technique. And we'll discuss more when we talk about the 3D suture technique, also known as 3D ST. This is the most advanced suture technique that we at the Dream Medical Group utilize. Lastly is the scar. Aesthetic surgery is a surgery where it is elective, and people do not want to show that they had surgery. People who had modern suture technique, the result is that there's essentially minimal scar. Why do I say minimal? Because with the naked eye, you cannot really tell if somebody had surgery or not, because it really does perform like a natural double eyelid crease. So I think because of all the bases that we have discussed, the advantage of suture technique just far outweighs the open technique. And I think we have to understand the evolution of surgery, of double eyelid surgery and Asian eyelid surgery, in that the double eyelid surgery, the fold formation initially started with an open technique because the suture technique didn't exist. And when the suture technique did come about in Korea, the first generation of suture technique was not sophisticated enough, and it had complications of fold loosening. However, with better understanding of fold formation, with better sutures and better techniques, essentially, the techniques basically changed what suture technique can do, and it gave so much more power to it. So therefore, a modern suture technique will far out compete and will far outperform any of the open technique and any of the older suture technique. And as I mentioned to you before, the newest generation, the 3D ST, the three-dimensional suture technique, is the most powerful and sophisticated suture techniques that we have.